Emily, I'm going to be your nurse today. How are you?
I'm good, how are you?
Good. I'm going to wash my hands and provide some privacy and put on some gloves. I'm going to ask the patient to identify their name and their date of birth.
Zachary Evanson, 070802.
Perfect. And do you have any allergies to medications or drugs?
Nope.
Perfect. Okay, I'm just going to do a cardiovascular assessment on you. Is that okay?
Yep.
Perfect. And I'm going to ask you a couple quick questions regarding your medical history. Do you have any hypertension?
Nope.
Coronary artery disease, chronic heart failure, any valve disease, peripheral vascular disease? All right, perfect. And then with your social history, do you smoke? Do you drink alcohol or take any illicit drugs? Okay. And then do you exercise? And how's your diet?
Good.
Good. And then do you have any stress in your life?
Yes.
With
Due to school.
School? Yeah, is it consistent?
Yes.
Okay, how do you manage that?
Exercise.
Exercise, it works.
Just kind of calm down a little bit. Yeah.
That's good, okay. And then with medications, do you take any antihypertensives like Lasix or antidysrhythmics such as metoprolol? Any anticoagulants like Coumadin? Any antilipidemics like Lipitor? Okay, or any positive inotropes like digoxin or any nitrates like nitroglycerin? Okay, perfect. All right, I'm going to start my exam. I'm going to first auscultate for his carotids, my diaphragm. Can you lift your neck a little bit for me? Okay, good with the diaphragm. I'm going to move on to the bell and listen for any bruits. Alright, no adventitious sounds were noted, so that's good. Alright, and then I'm going to inspect his chest for any lifts or heaves. Okay, and remove this. Perfect. And then no lifts or heaves are noted, and then I'm going to palpate for any lifts or heaves. Alright, and then I'm going to palpate the apical pulse. And I'm going to note that that was present as well. And then I'm going to start auscultating for the heart sounds in the aortic, pulmonic, Erb's point, tricuspid, and mitral areas while he's laying down with both my bell and my diaphragm. Alright, starting with the aortic, pulmonic, Erb's point, tricuspid, and mitral. Then we're going to move on to my bell. Pulmonic, Erb's point, tricuspid, and mitral. Alright, S1 and S2 were noted in all of those areas. No adventitious sounds were noted, which is good, no bruise. And then I'm going to have my patient sit up for me. Just in a normal straight up position. I'm going to do all those same areas again with my bell and my diaphragm listening. Aortic, pulmonic, Erb's point, tricuspid, mitral. Aortic, pulmonic, Erb's point, tricuspid, and mitral. Alright, also no adventitious sounds there either, and S1 and S2 were noted in all areas. And then I'm going to have you sit up and move forward a little bit. Perfect. And I'm going to do the same exact thing. Starting with my diaphragm, aortic, pulmonic, Erb's point, tricuspid, and mitral. Where's my bell? Aortic, pulmonic, Erb's point, tricuspid, and mitral. All of those sound really good. S1, S2 noted in all sounds areas. And then I'm gonna have you lay on your left side with your head at the end of this area over here on your side, and I'm gonna do the same thing. Listen again. With my diaphragm starting. Aortic. Pulmonic. There's point. Tricuspid. And mitral. Flip over my valve. Aortic. Pulmonic. There's point. Tricuspid. And mitral. Okay, perfect. And I can just have you go back to your normal position that we were in before. And all the sounds, S1, S2, were noted in all areas. No adventitious sounds or buoys were noted, so that's all good. And now I'm going to move on to your upper extremity evaluation. So I'm going to look at his upper arms, and I'm going to note for color and temperature, and look for edema, and then also palpate for edema. Everything is good. Then I'm going to check his radial pulses. They're good, +2 bilaterally, and then I'm going to do his brachial pulses. Also +2 bilaterally. And then I'm going to look at his nail beds and do capillary refill. Both were under 3 seconds, which is good. And then I'm going to do an Allen test. So what I'm going to have you do is put your arm up, bend, and then I'm going to have you squeeze your fist and then hold a fist. And then I'll push on your arteries here. And then squeeze. I'm going to release one side and have him open his hand and watch the blood flow go back. And I'm going to do the same thing. Squeeze, push, and open, and release. Good on this side, both arteries, ulnar and radial are good, and then do the same thing. And then squeeze, and then open. Okay, and then same thing. And squeeze, and open. Perfect. All right, and then I'm gonna move on to his lower extremities, and I'm gonna move up his legs or gown if he was in the hospital. And then we'd inspect from toes all the way up the leg for any edema, and then I'd palpate for edema and touch for color and temperature. Everything is good, warm to touch, no edema upon palpation. And then I'll palpate his brachial or popliteal pulses, and they're both +2 bilaterally, and do the posterior tibial pulses, also +2 bilaterally, and then the dorsalis pedis pulses, also +2 bilaterally. And then I'd have him remove his socks and do his capillary refill on all toes. We note that they're within normal limits of under 3 seconds. And then I do the Holman's test, testing for deep vein thrombosis, and elevate his legs and have him flex his foot. Is there any pain? Okay, good. And then I do the other leg and flex the foot. Any pain there in your calf? Okay, perfect. And then that concludes my cardiovascular assessment. I adjust him back to normal. Do you have any questions for me? Perfect, thank you so much. And then I'd provide privacy, wash my hands, and then leave the room.